Governments across the country are responding to an urgent call for action to protect some of the most vulnerable from COVID-19, those in long-term care homes. Now, in Ontario alone, more than 100 homes have outbreaks. More than 140 people have died.
We'll continue to use every tool. We will spare no expense to protect residents and staff and keep them safe and healthy.
The plan includes more aggressive testing and screening measures in homes and ensuring facilities are stocked with personal protective equipment. The province will also move healthcare workers from hospitals and community care into homes to ramp up staffing. Now, one of those homes, Eatonville Care Centre in Toronto, has so far reported 30 deaths linked to the virus. Maria Tomaszewski was a resident, and sadly, she passed away yesterday. Her son, Henry, made the difficult decision to move her to a hospital because he was concerned about the lack of care at the home.
I moved her Thursday evening just because when I did go visit her with my brother on Thursday afternoon, and I just, the sight of her, she was, had her, mouth open and gasping for air, and I just didn't think that she was getting the care that she needed. I knew that maybe there wasn't any hope of her surviving, but I felt that she was really suffering, and I really wanted to ease that her suffering at least, and I figured that we would get better care at the hospital.
Now he adds he hoped nursing homes would take necessary precautions, including segregating residents, which he said was not really happening at Eatonville. Let's go to Marissa Lennox. She joins us now. She's Chief Policy Officer at CARP. Marissa, thanks for joining us today.
I'm happy to be here. Thank you.
So we are seeing a shift that is beginning, I would say, to focus on nursing homes, long-term care homes, and what they need. What's your take on so far what has been announced?
With respect to what the Ontario government announced yesterday, I think a lot of the measures are consistent with what seniors advocates have been calling for weeks now. So I think they're good. I think they need to be implemented immediately, but I regret that they were not called for and implemented a month ago.
Can we talk about testing, for example? Have you heard or seen about a lot of testing in nursing homes?
No, that's actually been one of the biggest challenges in these homes. What we know about this virus is it presents itself differently in different people. Some people may be perfectly asymptomatic. So that's one of the biggest challenges in trying to control the spread of disease. There are a number of reasons why outbreaks are difficult to control in long-term care homes. Another big challenge is the ability to separate residents that are positive from those that are not. Because of close proximity of residents and because of a lack of space in some of these homes, if a facility can't move people around, that can be a really big challenge.
And why aren't some of these people who test positive and are clearly extra vulnerable because of not only their age but their health moved to hospitals faster?
It's a good question. Also, with what we know about our hospitals, they really haven't seen the surge that was originally projected. So it's a good question. Why weren't they moved? I think in some cases, and I can't justify really the actions on the part of the home, but maybe they felt like they could meet their care needs from there. But certainly we know that that's been a real challenge in homes right across the country.
Yeah, I'm wondering if there was any advice against taking people to hospitals because the hospitals were expecting to be at capacity or over capacity.
From what I understand, guidelines vary from province to province. What I understood from Ontario was that if someone was exhibiting mild symptoms, to isolate them in the home. If they were severe, then they needed to be transferred to hospital by ambulance. But obviously that isn't the case.
When you have so many people dying in one facility, you would have believed that there would have been a call out to help. Are those calls coming from the home sort of as soon as they see somebody die or two people die, or are they trying to manage themselves and perhaps getting themselves into situations where they're just too overwhelmed?
No, I think that the care workers have been asking for help for some time. We've seen stories of whistleblowers saying that there aren't enough protective equipment for staff, challenges with respect to staffing levels and testing, even with respect to staffing levels. This is a perennial issue that we see in long-term care homes, and you wonder why it hasn't been addressed sooner. It makes you feel like long-term care was really prioritized last in this entire process. But to your question, we have heard a lot from healthcare workers asking governments for help, and they've been slow to respond.
So we understand from what Ontario has unveiled that people who are symptomatic in homes will be tested, and those connected to them who might not have any symptoms will be tested. But it doesn't sound like they're going to test sort of everybody in these homes. Are you calling for that at this point?
We are, and we have been for weeks now. We know that where there are people in homes that are positive, it's very likely others are, just because of the communal living arrangements. There's communal dining, there's communal bathing in some cases, shared bathrooms, even shared living rooms, shared bedrooms, often separated by a curtain. So given what we know about how these facilities operate, the lack of space, I think it's really important that all staff and residents are tested systematically right across the country.
Marissa Lennox, I've got to leave it there. Thank you for stopping by. I appreciate your time today.
Thank you for having me on.